Hello, my name is Sonia Landívar, one of the staff Spanish medical interpreters at Gunderson Lutheran. I chose the subject of being a medical interpreter as my subject because I think that very little is known in this area about this profession and the principles interpreters need to abide by during their work with limited English proficiency patients. First of all, I would like to establish the difference between interpreters and translators. Interpreters focus on spoken words, while translators focus on written material. The fact of being bilingual does not mean that we can work as either interpreters or translators. Both fields require a different set of skills. Some bilingual individuals are excellent translators, but that doesn't necessarily mean that they can be very good interpreters. Sometimes it is the opposite, and sometimes they can do both. Translators need to have a general knowledge of certain specialty fields, superior writing skills, and an excellent command of grammar and style. Companies pay high rates for translation services, therefore they expect quality. On the other hand, interpreters' main role is to facilitate communication between healthcare providers and their patients with limited English proficiency by converting messages from one language, which is the source language, into another language known as the target language. To perform these duties effectively and efficiently, interpreters need to have a wide knowledge of medical terminology and a general understanding of medical concepts and procedures. Interpreters need to display the skills, knowledge, abilities, and behaviors that would allow them to comply with the principles of the Code of Ethics for healthcare interpreters, which are first, confidentiality and information disclosure. Interpreters must respect the privacy of the patient and the personal nature of the medical encounter. According to the Code of Ethics, interpreters need to encourage the patients to share relevant information directly to the provider, not to the interpreters. The second point is accuracy. Interpreters must make every effort to render the message accurately and taking into consideration its cultural context without losing the essence of the meaning, without making judgments as to what is relevant or acceptable or important, and without omitting to, adding to, or distorting the message. The third point is impartiality. Interpreters must maintain impartiality and refrain from counseling, advising, or projecting any personal beliefs or biases. With this in mind, we need to understand that our role is to facilitate communication only. The fourth point is boundaries of the professional role. Transparency and conflict of interest are the two professional boundaries that interpreters must be aware of. Transparency means that we must avoid getting involved in roles that do not pertain to us, even if we feel qualified for them. Conflict of interest means that interpreters need to minimize the depth of their personal involvement with the patients they work with in order to avoid interference of personal opinions that may influence their behavior during a medical encounter. The fifth point is awareness of their role and other cultures. Awareness of their own culture and other cultures. Interpreters need to be aware of their own culture in order to be able to focus on the meaning of the message and refrain from involuntarily interject their own perspectives or ideas. In addition, interpreters need to have enough understanding of the other culture in order to understand more fully the meaning of the message and to avoid potential misconceptions. The sixth point is to treat all parties with respect. This principle means that interpreters must have the ethical obligation to treat everyone in the encounter with dignity and courtesy, promote the autonomy and expertise that each party has, allowing patients to decide what is best for them, and letting providers offer clear and objective information that will enable the patient to make informed choices. The seventh point is advocacy. Advocacy is not a role of an interpreter. However, when the patient's health or well-being is at risk, interpreters must be quick and swift to refer these patients to the appropriate instances within the medical facilities we work for. We must not take an action that goes beyond facilitating communication. The eighth point and final point is interpreters must strive to continually further his or her knowledge and skills. This will enable them to continue performing their duties competently through a fluid interpretation. It is my hope to have achieved the purpose of familiarizing you with this very rewarding